Broadcasting live from the Business RadioX studios in Atlanta, Georgia, it's time for Atlanta Business Radio. Brought to you by OnPay. Built in Atlanta, OnPay is the top-rated payroll and HR software anywhere. Get 1 month free at onpay.com. Now, here's your host.
Lee Cantor here, another episode of Atlanta Business Radio, and this is going to be a good one. Today, we have with us Mike Fite, and he is with One Medical. But before we get started, I'd like to make sure we thank our sponsor, OnPay. Without them, we could not be sharing these important stories. So, Mike, before we get into things, let me ask you, tell us about One Medical. How you serving folks?
Yeah, and thanks for having us having me here. Yeah, One Medical is a modern primary care practice that has about 85 locations all over the United States, from San Francisco, San Diego, Portland, to Chicago, New York, and DC. Now we're moving into the Atlanta market. So we're really happy to introduce our primary care model into Atlanta.
Now, I go to a typical doctor. I got to make an appointment. It's over the phone. Everything's with paper. It seems like I'm back in time, 25 years from when I deal with other industries. Is the kind of medical practice business, is that something that is kind of stuck in time and One Medical is trying to kind of get it going into the present day?
Yeah. It's funny you mentioned that because I've been practicing as a family doc, a family physician for about 20 years. And actually my very first job was here in Atlanta 20 years ago. And it seems like not a whole lot has changed in that primary care space in the whole time that I've practiced. So One Medical is different in the sense that, for one, there is no paper. There's very little paper. We have a very user-friendly, almost slick application. Using our application is more like a banking app than it is the usual kind of clunky portal that you have to use in most traditional medical facilities. And part of the reason that is we have over 100 engineers and technicians that have spent most of their time, they spend all of their energy trying to make sure that whatever we have that's facing patients is very user-friendly and easy to use. The other thing about One Medical that I think is different, which really attracted me to the company itself, is that it really utilizes and optimizes virtual care. And I'm not talking about the kind of virtual care where you might be fortunate to get a hold of a doctor during business hours and not have to go in. And the amount of things that you can approach them on are very limited. I'm talking about 24 hours, 7 day a week, 365-day virtual care where you can literally get you may get a doctor or a nurse practitioner or a PA that can actually understand your issues, your concerns, and diagnose you and treat you if it's appropriate over the phone or through a video conference. So I think you're right. Like, we're really trying to bring primary care. We specialize in primary care, and we really want to bring primary care into the 21st century. And also we want to create spaces in the office that are really comfortable. And so when you come to our practice, you'll find really nice, very comfortable places to spend your time, but you won't spend a whole lot of time because we also are very intentional about starting on time and ending on time, because we want to respect your time, because we know that our folks are busy.
Now, another thing that differentiates One Medical from a typical practice is there's a membership. And, I like that point of differentiation because membership has its privileges. What are some of the benefits of being treated as a member?
Yes, and I'm glad you brought that up. So membership, our membership typically is an opportunity for you to get that 24-hour a day, 7-day a week, 365 access to our virtual care. You can book anytime with One Medical, and that actually gives you access not only to virtual care, but to any of those practices that I alluded to across the country. So if you're traveling, you can get basically same day or next day access to an inpatient visit with any of our providers in any of the locations and cities that I mentioned, not to mention the virtual care. And the other thing that I think is important is that, the membership is $199 a year. And, I hear a lot of folks are, saying, well, what do why do I have to pay on top of insurance or whatever? But if you break it down, that's like $16 a month. And for $16 a month, you could very easily save yourself an unneeded urgent care or ER trip, which probably would be worth the cost of that membership in that one in that one encounter.
Now, what's the best way for me to kind of get the most out of my membership? Is this a situation where, like right now, I only go to the doctor if I have to go to the doctor? Is it something where I should be using this maybe more proactively in the sense like, oh, I should get my physical. I should be doing certain kind of maintenance checkups in order to, make sure I'm in optimal health instead of just reacting when something bad is happening?
Yeah, So I have a lot of patients that are like that, in the sense that we only go to the doctor when we're sick. And, that's pretty common because that's how we've been educated and trained. And so One Medical, we want to, we really want to spend more time discussing like prevention. So not only is it important to see a doc or see your provider when you're sick, that goes without saying. But we want to try to get to you before you get sick. We want to try and spend time talking about lifestyles that reduce the chance that you'll end up with a chronic disease like hypertension or diabetes. We want to make sure that we get you vaccinated appropriately to help protect you from diseases in the time of COVID. Obviously, that's a big deal, especially as we're moving into influenza season in the next 2 or 3 months. And obviously, there's been a lot of conversation about that. And we want to uncover those chronic diseases early so that we can address them and keep them from progressing into more serious complications like with hypertension and kidney disease and diabetes and heart disease and things like that.
Now, let's talk about COVID a little bit. What's the experience going to be like if I have to go in there just for maybe a well visit? Is that do I text before I get in there? Like how do you handle kind of a separated the patients, and are there multiple people in the waiting room? Like how do you guys handle that? Well,
okay. So a typical visit to a One Medical practice, as long as you're talking about an inpatient visit, because the virtual visits and the virtual cares is pretty simple as well. But what would happen if you want to see a doc is you're going to simply go to onemedical.com. Or look it up and Google it. You'll come up to One Medical. You can download the app into your phone, and then at that point, you're going to basically, fill in a few keystrokes and some basic information that we need to identify you. And then at that point, you're within a couple of keystrokes and buttons, you're going to select the type of care that you want, whether you have an issue that is relatively simple, which we call a treat me now, or whether you want to establish care with a primary care provider virtually. You can do that as well, which we call a remote visit, or you want to come in and get seen. So any of those things, any of those options are all available to you. It usually takes less than 10 minutes to do, and within 24 to 48 hours, you can see a doctor or a PA or a nurse practitioner live in our office, or even less than that, in 5 or 10 minutes, you could be seeing or talking to one of our virtual medical team.
But if I decide to go in the office, is there any kind of precautions that are taken to, do I have to wear a mask? Like, what are the rules to come in the office?
Yeah, good question. In the days of COVID and this pandemic, safety is at a premium, and it's really at the top of everybody's mind. And so we have basically restructured the way that we see patients in order to optimize safety. So it's already recommended by the CDC that if you're in public spaces, it's recommended that you wear a mask. That mask can be a cloth mask. That mask can be it can be cotton. But we ask that you wear your mask in. But even if you don't, when you get in to our office, we're going to provide you with a mask. And then in the office, we have implemented a series of safety features to help maximize social distancing, to make sure that you can sanitize your hands. And also we have HEPA filters that have been EPA approved to help make sure that we decrease the chance of the spread of the coronavirus.
And right now in Atlanta, there's one office, or is there more than one office right now?
Right. Well, we just so we opened our first office in Midtown. We opened that about a month ago now. It's been officially, I think it's 1 month today, as a matter of fact. And so that's been a great success. We've had a number of patients from all over the country who now live in Atlanta, who were previously One Medical patients and members who were literally waiting for us to open. So we've been open for about a month here in Midtown. And then we just recently opened one at the Battery, which is up at Truist Park Brave Stadium. We opened that one last week, and that's been going pretty well. It's a great location, a great place to get medical care. We anticipate that we'll be opening one in the fall at Buckhead. The Buckhead Terminus building is where it's scheduled to open, and that should be we're hoping October, but definitely this fall. And then we'll be opening one at some point, probably early 2021 in around Perimeter Mall.
Now, how difficult is it? Like I've been saying, if I wanted to switch to One Medical, I've been seeing this guy for a long time. How does that transition? Do you help me at all with the transition to get all my records to you? Is that something that's all handled between you two? What's the change cost for me to switch to One Medical?
Yeah. So we have some really highly trained administrative specialists who will help to secure your old records. There's even an opportunity to help facilitate that through the app itself. The request, that is. So it doesn't cost anything extra to join or to come and see us. And typically we will, once you authorize us to get the old records from your previous doctor, then we'll take it from there. At that point, you just come in and we'll take it from there. One thing I think is probably important to know, One Medical has been very intentional. We've been really intentional about our primary care and providing like the best primary care that you can get anywhere. We want to make sure that we provide our members with superior service. And part of that is actually collaborating with Emory. So we're now in the Emory network. We collaborate with them so that we want to make sure that not only do we give, superlative primary care services, and we're full spectrum. We see right now we're seeing teenagers through adults, and at some point in the future we hope to bring on pediatrics from 0 to 14. But not only are we doing full spectrum primary care, but we've got Emory collaborating with them. So any type of specialist that will be required, any type of imaging that might be needed, we are working very closely in a seamless fashion with Emory. And that's been going pretty well as well.
Now, do you work with some kind of enterprise level companies that you're partnering with?
Yes, we do. And so the organization, so One Medical, we work with Emory as I mentioned, and so we do collaborate with them and some of their patients. But we also see patients who are enterprise. Those enterprise patients are typically organizations that are forward-thinking, who really want to provide and differentiate themselves from other employers by providing their employees with opportunities to stay healthy, to be healthy and stay healthy. And so, we do work with different enterprise organizations, and so it's basically a benefit that the organizations offer the employees, and that also has worked very well as well, because we have folks who are who travel from city to city as part of those organizations, and they secure their care both in New York and Atlanta based on how often they need to travel, and that works pretty well for them.
And then if somebody wanted to learn more about One Medical and maybe switch to you here in Atlanta, what's the website?
The website is simple. It's just One WNE Medical. You could do onemedical.com, but if you look up One Medical, then we'll show up. It's a very nice website where at that point you can learn more about us, and from that website you can literally join. It's actually that simple.
Good stuff. Well, Mike, it's amazing the work you're doing, and we're excited about having One Medical here in Atlanta. We've been waiting for this concierge level medical practice service to finally get here, and we appreciate the fact that you guys are here.
Well, and we really appreciate, and I appreciate specifically you being on your show and getting the opportunity to kind of share all this good news with you all. And we look forward to maybe coming back and talking about how we've done over the next 6 months or so, and also having people come in and then be part of a pretty good situation.
Sounds good. That's One Medical, spelled out ONE medical.com. Check them out. Definitely, if you're ready to move your primary care medicine to the 2020, I think you deserve it, and check them out, because there is a big difference between what they're doing and what's out there. Well, thank you again, Mike, for sharing your story.
Thank you so much. I appreciate it.
All right. This is Lee Cantor. We'll see you all next time on Atlanta Business Radio. And remember, this work would not be possible without the support of our sponsor, OnPay. Please support them so we can continue to share these important stories.
Today's episode of Atlanta Business Radio is brought to you by OnPay. Built in Atlanta, OnPay is the top-rated payroll and HR software anywhere. Get 1 month free at onpay.com.